Okay, hello everyone. Welcome again. My name is Dave Duncan. I am a teacher at San Joaquin Memorial High School. And recently I had an interview with Dr. Ian Tong, who is the Chief Medical Officer of Doctor on Demand, which is a virtual care platform which strives to bring doctors closer to patients that may have access issues as far as getting into an office or just to help those so that they can visit through a virtual platform. And he's with me today. I have a class of students who have several questions that they've submitted for him, and we're going to go through the list, and I'm going to ask him a few questions, maybe a couple afterward. So I really appreciate you spending your time with us this afternoon, Dr. Tong. So thank you and welcome.
Yeah, thanks for having me, Mr. Duncan. I really appreciate you doing this for your students, and it's very timely, as you said, to be able to use virtual care or care that's provided at a distance to reach out to patients. But it's just as important right now for education because we're not able to congregate in large groups. So thanks for the work you're doing.
Thank you. Okay, so I'm just going to hit the list here.
All right.
In no particular order. Actually, this is in the order that they were submitted. So I guess you're going to have the most students that submit things quickly are going to be the ones that you're going to get the questions from first.
All right.
So we'll identify the lagging students at the end. Okay.
Those might be you never know. Those could be the more thoughtful. That may be the ones who took their time and came up with the real, the real tough ones.
I think you're right about that. I should have thought about that. Okay, so here's my first question. Now, Dr. Tong, okay, I better turn off my dinger and my phone and all that kind of stuff. Hopefully, I won't get too many interruptions here. For everybody that's viewing this, Dr. Tong and I had an earlier appointment set, and he had some issues coming up, and I was at school, and the Wi-Fi was down. So I'm frantically hitting the keys, trying to tell him, well, on my phone actually, because I couldn't use my keyboard, trying to tell him, hey, I'm having technical difficulties. I can't meet with you. And Dr. Tong was having his own issues. So we managed to reconnect an hour or so later. So I really appreciate him being here. Okay, so I have a few questions from ACNUR. And here's the first question. What are your thoughts on a statewide lockdown? And there's a secondary question to that. How would that affect doctors and nurses if there were such a thing, if we did go through a statewide lockdown?
Yeah, and that was from ACNUR?
Yes.
Oh yeah, ACNUR. So good question. My thoughts on a statewide lockdown are that it's actually a really good thing to do in this setting when we have this particular illness and some of the characteristics of this novel coronavirus. So I think it's a good idea, and we've actually already now. I know I know that some of these questions were from early on. So I think we're starting to see now some of the effects of actually the social distancing programs and the deeper enforcement of those programs. So we're actually starting to see some leveling off and flattening of the curve, if you will, of spread of the disease. So I think that's the answer to that first part of that question is I'm in favor. And if you looked at what other countries did in the very beginning, the ones who performed the best were the ones who actually did the most strict enforcement of the lockdown and taking people's temperatures, even if when you attempted to leave your home, someone would take your temperature. And actually, in some cases, they would even go to your home. In China, I think they were going to people's homes, checking their temperatures, testing them. If they found people who were febrile or had fevers, then had other symptoms and tested positive, then they were removing them from the home and putting them in a COVID ward, so that they could recover and they would prevent the spread of the disease. So we haven't gone that far, and I think we're unlikely to go that far here, but I agree with the lockdown.
Okay, you said a ward. I thought you said a morgue.
Oh, no. Okay, that's a ward.
Okay.
No, let's hope not. Yeah, no, just a designated treatment area for COVID patients.
Okay, great. Thank you. Now, the second question she had was, And this might be another one of those time factor ones. It says, at the rate we're increasing for the number of COVID-19 cases, there will eventually be more patients than there are doctors. What should be done if a facility has 30 doctors, but there's 100 patients? Has that happened in some of these heavily affected areas?
Yeah, let me see if I understand it. And actually, I forgot to answer part of the last question, which was like the lockdown for healthcare workers. And I should have said or pointed out that healthcare workers are exempt. That doesn't, so if they get sick, they can get quarantined and they'll follow the same recommendations as any other patient. But in terms of lockdown, no, the hospitals stay open and healthcare workers still go to work. I'm lucky as a virtual care doctor. I'm really physician executive, so I don't do as much direct patient care at all anymore. But even if I did, I would be doing it at a distance. So it's actually safer. It's a safe scenario for a telemedicine doctor. And the question of I think the question there is really what happens to a health system if the doctors all get sick, and that is actually a true risk. The smaller the healthcare, like the smaller the hospital or the smaller the clinic, if you think about that, or the smaller the practice. So in Fresno, there's a lot of individual or onesie, twosie doctors in a practice, a smaller practice, running a small business. If they get sick, I mean, this is absolutely very threatening to their business. And so those doctors, that's why it's so important that they have the PPE, the personal protective equipment that's appropriate. They should be careful. They should wipe down their areas. I mean, they just have to be very careful. And there has not been an instance, however, where a hospital, this is one thing that I don't know if it's a myth or what the reasoning for this is, but healthcare workers, when they get sick, they tend to get like really sick, but usually they tend to do well with all these little minor illnesses. And I don't know if that's because we're always exposed to illness, and so therefore our immune systems respond to that or are better prepared for it. But I don't believe that's happened yet, where we've seen an epidemic or this particular pandemic spread through a healthcare system and knock it out in numbers.
Yeah, I've heard people say the same thing about teachers because we're around kids who are vectors.
Yeah, it's right. Like your teachers are there we tend to show up for work pretty consistently.
Yeah, you don't want 30 people standing outside the door wondering where you are.
That's right.
Hopefully we will have that situation. Not that I'll be late to class, but that there will be kids wanting to come into my classroom soon.
Yeah.
I'm looking forward to getting back to that. Okay, so I think you covered her third question, which was what can be done for the safety of doctors and nurses. So PPEs and just
telemedicine is actually a super important thing that can be done, and that's what I do. Now, I did not do that for this instance. I used to talk about telemedicine as a way to prevent vulnerable patients from having to go to places where there are other sick patients, which is true also. But in this case, what we're seeing is, and related to this question is, it's much safer for doctors. If I was a doctor over 65 years of age and I had diabetes, and I have physician friends who have medical conditions, this is a scary scenario for them to try to go to work and do their job and then have a sick patient come in and expose them is not, it's potentially life and death matter.
Yeah. Okay. All right. So then we'll move on to another student. Emerson has a question, and her question was, as weeks go on, do you expect this virus to get much worse before it gets better? Will we see an incline of deaths before the curve begins to straighten? Or maybe can we prevent this by all staying at home, our own behavior? And then she says, it's a multitude of questions together. More specifically, are we as Americans too late to overcome this virus?
Yeah, there's some complexity in that one. So see, as we're getting down, Emerson got complicated with the question. Emerson, it's a good question. Let's see which parts to take there first. So first of all, we are seeing a flattening of the curve, but if you look at different parts of the country, different states have had different types of responses. So in California, in general, we responded pretty aggressively and earlier than New York. So I think that's we'll just use those as contrast of one another. Very different spread of the disease. Also, though, if you look at how we're set up, you New Yorkers use a lot more public transit in Manhattan and Brooklyn and the Bronx and so on.
I've seen
LA,
pictures.
everybody gets in their own individual car, right? So we had some. I think there are some social determinants of the way we live in different states that also make a difference. So I would just say that, but we're probably getting through this first wave. But that is, but we have a risk of going into a second wave and the curve turning back up again, if we relax the enforcement of social distancing. So those are a couple of chunks to think about. We should probably I might ask you to ask a couple of the follow-up questions that she had, and as I decide how deep to go into these answers. But one thing I think that is important to know, from an epidemiologic standpoint, is that COVID-19, it's probably not going to hit enough of the population to provide what's called herd immunity.
Well, I was hoping I was wanting you to touch on that.
Okay, so yeah, so as long as we social distance, we might be able to prevent this disease from crossing 30, 40, or 50% of the population. My suspicion is that over time, over 1 year or 2 years, you might have where 80% of the people in the country have gotten this, or 80% of the people who get it are going to have almost, mild to no symptoms at all. However, a lot of people, like I said, and I don't know the exact percentage for this illness, so we don't know, but a lot of people have to have it before we get herd immunity, where the disease, even if it comes through another wave, where we're actually protected because people who've already had it aren't going to be able to pass it to other people. We're not there yet. So that's why we need to continue to enforce these. And then Leslie, what was the end? She had what was the last two parts of that question?
Can we prevent it by staying home? And more specifically, are we too late?
Yeah,
to overcome the virus.
So we can prevent the spread by staying home. Too late is a relative question, because I would say for the testing, we're not too late. Actually, I don't think we're too late, because not many people have had it. So we can use aggressive testing, as they did in Hong Kong and in Singapore, and Taiwan. We can do that in areas to cut off and identify any new positives, and then isolate and do what's called contact tracing, trace all their contacts, and then strictly enforce quarantine on those individuals. So we're not too late for that. So I would say, I think we can still implement those.
I've also heard I just briefly heard about this, about where they might be able to test people who have been exposed to it and might have some kind of an immunity to it, and allow them certain access privileges that other people won't get. Almost like a social, you have a higher status of freedom.
Yeah. It's a bit of a phased approach, or but it kind of feels a little bit like the Scarlet Letter, as I recall. I think I read that in high school in my freshman year.
A big C on your forehead.
Yeah. You can have a C on someone's, on their lapel or something that says if they've been through it or not. But and I'm trying to make this, fun to learn about, you guys. But it's obviously a serious condition and a serious issue, partly because of this kind of a practice could cause stigma. Could have people that can't return to their work beginning to get desperate, and so then trying to find ways to game that system and cheat it, right? And so I think there's a lot that could happen there. But I think one place that's interesting to read about, people can read about Sweden. I think they actually took a different approach. And so it's a good place of learning, and we should all learn from, I'm not saying we should do what they did there, but just thinking about how we want to take this on still going forward. America versus Sweden. Sweden has their kids, because kids are somewhat protected from the more severe versions of COVID-19. They're actually letting the kids go to school. They're letting them go to school, they're letting them gather, and they're saying, you know what, if you get this, you get it. And I think Sweden's also saying, well, we're going to probably take some losses, but we can let certain populations get exposed, or we might be able to afford that. And that might be a way to get towards, closer to herd immunity. So it's an interesting strategy they're using. Yeah,
it is a cost analysis almost, in terms of life and death. I know that love him or hate him or however you feel about him, I know that Dr. Oz really came under some heat about saying, hey, well, maybe if we get everybody back in school, we might have 3% more fatalities, and people are just going for his throat because
Yeah.
how could you do this? You know, how could you think that way? But if we look at the terms of shutting down an economy, I mean, how many people are going to avoid care because they're worried about being out in this, and they're not going to get the help for their heart disease or something along those lines?
Well, I think a way that students might, this is a good debate for students. I would love
Oh
I'd love
yeah.
to have a group Zoom with all your students and have them have debates on this, because this is a question of the me versus we in my mind.
Mm-hmm.
America is much more of a me society, meaning like, well, wait, how could the individual is so important in America that we would say, don't take away my individual rights. It's in our Constitution, right? So this is a very, not to combine too much science and social studies and history, but I think it is, this is where this stuff starts to come together and science and policy start to intersect. Whereas the we, China or Singapore or Sweden is probably a little bit more of a we approach. And so they're doing that cost benefit analysis, and they're accepting losses, and it might be a little bit more of a we saying, well, we're doing something because of it's all about the greater good. It's not about the individual at this point. So it's an interesting debate to have.
It's interesting that you would also bring up Sweden, because I was just watching I was watching a show that was referencing a 60 Minutes Australian version.
Oh, yeah.
And they were reporting on this, and they did highlight Sweden and how they were approaching it versus various other countries, and it was quite interesting. Okay, so we'll move on to the next student is Emily, and she had a few questions. She had a question about virtual care, and that was, how does that impact people's accessibility to medical assistance and healthcare in general? But before I can repeat the question for you.
Yeah.
Just a side note, between our failed earlier meeting and this meeting, I was getting ready to come home, and I heard my phone rang, and it was a doctor's office saying, "Are you ready for our scheduled teleconference?" And so I came in and I sat down at my table here and had a question and answer session with the intern.
Yeah.
And then she said, "I'm going to introduce the doctor." And then the doctor came in and he goes, "Hello, my name is Dr. Van Gundy." And I said, "Van Gundy, that sounds familiar. Are you any relation to Katie Van Gundy?" And he goes, "Who are you?" Anyway, his daughter and son went to Memorial.
Oh, no.
It was a small world, but we were teleconferencing. Oh, one last thing. California, at least here in Fresno, I am noticing a lot more people are wearing masks in public.
Yeah.
A lot of them are doing that.
Yeah.
Very well. Don't ask me how I know.
Yeah, no, I mean, I think we've gotten to that point where, it was recommended if you're, at the state level too. And then I think Los Angeles actually said last week that they were going to enforce that starting Friday of last week, that they were going to enforce it. And if you didn't have a mask in public areas and supermarkets, and if you were in the line, that the clerks could refuse you service. So they were going to strictly enforce that. We didn't do that across the entire state, and I think it's important to recommend, to know there's a difference between medical grade masks like N95s and surgical masks, and just any kind of mask or a facial covering like a handkerchief or something like that. So I think we're just asking people, right, to do what they can to prevent that spread of disease if they have to go out. And I'm seeing a lot more masks all over. I mean, yeah, up here in Northern California as well, even though I'm not going out much, but I see my neighbors like to walk up and down my street, lots of them, and the weather's gotten nice and a lot more people are wearing their masks. So I don't, it was, and Emily, Emily, it wasn't Emily Wathen. What was the, but I don't think it's a Wathen, is it? But anyway, but Emily.
No.
Okay.
So Emily's question about the virtual care, how is it affecting people's accessibility to medical assistance and just healthcare in general?
Yeah, so it's really an interesting story here. Fewer patients are going into the clinics. Actually, there's been like a 30% reduction in heart attacks. since COVID-19 began. So does that mean people didn't have heart attacks, or does it mean they're avoiding unnecessary care? I think people don't know. But no doubt it is affecting people's access, and patients themselves are actually really deciding whether they really need to have a doctor visit. That's actually, and we've seen that. So that we were sort of seeing lots of demand for telemedicine, and even that has leveled off a little bit because I think people are deciding, do I really, do I need to see a doctor, or can it wait? And I think a lot of people are just trying to wait, both for virtual visits as well as in-person visits. Two reasons. Probably one, they want to make room for the patients that really need to be seen. So I think people are kind of trying to wait and see if they can hang on. But I think also they're trying to avoid, they just want to avoid infection themselves too for the in-person side.
Yeah. Okay. Next question is, it kind of has to do with vaccines. And this is another question from Emily.
Yep.
Her question was, why is an RNA vaccine harder to create? And then how do certain pre-existing drugs, such as malaria drugs, work on COVID-19? I know there's been this talk about chloroquine nitrate. Yeah. I mean, I don't know the actual name, but I know it's like mefloquine, chloroquine, something.
Yeah, malaria drug, mefloquine is a malaria drug. Hydroxychloroquine is something called Plaquenil, which is like that's an immune modulating drug that, and I'll be honest, I don't think I'll be able to describe why those or how those drugs work at the molecular level. I'm not so sure that we're fully aware, but what I would say is that the lung injury that is caused by and the more severely ill patients, the lung injury that they see, a lot of that is your body having this cytokine storm, it's called, which is a natural part of an inflammatory process. So some of those drugs work as anti-inflammatories, or they affect the immune system in a way that must flip a switch or kind of turn off a switch that might actually prevent the storm of those cytokines and the release of those cytokines, or hamper the body's own ability to fight infection, because it's the body's ability to fight, it's the body's response to infection that actually starts to create the lung injury and the scarring of the lung. So that's what I mean. That's the extent of my remembering some of the early pharmacology and pharmacodynamics of that. The original part of that question was, and sorry, yeah, it's end of the day, but I think it was, what was it? It was the
RNA vaccine.
RNA piece, yeah. So RNA, and why? So RNA is just unstable. It's a less. If you think about RNA is like is almost like a mirror image, if you will, of the DNA strand, right?
You mean like a transcript?
It's a transcript. That's true. These students, yes, true. These are students, right? It's transcripted, right, from the transcription of the matching pair, if you will, right, of the DNA of one strand of the DNA. So remember, so when you unravel DNA is supposed to be double, right? It's a double helix. It's two double-stranded, and it's a very stable molecular compound when it's that way. But if you unravel part of it, the DNA gets unstable too. So that's why I mean, I don't know how deep to go. Your science teacher could probably help with how deep we need to get in this and what you guys are how far you guys are along this. But you make a single strand, and it's just far less stable than if it was double-stranded. But it's very effective at delivering and it's called messaging, right? Carrying that transcripted message to where it needs to be to then produce a new DNA, potential DNA strand, right? That is a repair of a damaged strand of DNA or what have you. So it's not meant to be. It's really meant to carry the transcription, but not stay in existence in that form. And remember, because it's like a mirror image or a transcript that's a matched pair, when you match it back to DNA, it's actually not the exact same as what the RNA was, right? It's not the same base pairs. It's actually slightly different. So I think what you end up with when the stable form of the DNA is the strand that you want, and the RNA was just the translation, right? It was just the transcription that gets translated back to the DNA, which are different base pairs. So you don't need it, basically. And the body does not create or keep things The body is built for efficiency, and a lot of our processes are built for survival and efficiency. And so it's not efficient to keep a bunch of old RNA anyway. So it's not even intended or needed to be stable. It's just it's done its job, and it degrades quickly, and that's what we want it to do. That's what we need it to do, so we can move on and don't have a bunch of needless RNA built up in our cells.
Right. Okay, great. Now this next question, if you don't mind, I'm going to try to.
By the way, that one was challenging because I had to go back and think about, like, I don't learn about that. Like, that was a long time ago. But
yeah, that's why that's why I dropped that little transcript.
Yeah. Reminding me.
Hey, I see it every year, so that's my excuse.
Yeah.
Okay, so this one ought to be easy. So let me try to partially answer it. I think this is what I'm hearing. So here's Emily's last question. In your opinion, why does Italy have such a high death rate in comparison to the United States? Now, here's the two things I've heard.
Yeah.
Number one, I've heard that a lot of people in Italy, the familial structure is much different, where most adults with families live with their parents. So the grandparents live with the families. And that's probably the major thing. The other thing that I've heard is the region of Italy where this hit was a lot of elderly Italians go there to retire. So that's what I'm hearing. Any?
Yeah, well, I think it does. It probably, I think that makes sense that it has to do with the social structure and a bit, and those are what we would call social determinants of health. Italy is, and honestly, you could see Italy as a very good comparison between America, to be honest. It's a good health system. They have outstanding doctors. They have the right equipment. It's not like, it's a developed country just like America. But yeah, I think that the social structure just is different. And so they have, but I think to be honest, they're also an older society. They have children later in life. And so the average age of Italians is higher than the average age of Americans. And so they're going to have a higher rate because we just have more kids, right? We have more kids, we have a younger society. So anyway, so I think there's a lot of that tied up into the why they seem to get harder hit. They just have a more at-risk population for this illness. If the illness was worse for kids, like flu, and America probably gets hit worse by the flu than Italy because we've got so many more kids than them.
Okay. All right. Great. Okay, so we're going to move on to Hannah. Hannah had a question, and it was, if doctors knew about the virus back in December when it hit China, her question is, why didn't doctors in America or researchers in America start working on a vaccine right away? Or why does it seem that they waited so long to start to develop one? And I don't know if that's the case or not, but that's the question.
Yeah, it's hard to know, but I think there's evidence, I think, that suggests that there was some delay. It just doesn't. And I think you can rationalize that to one degree by saying, well, we closed the border. And I think that's what the president's saying. I closed the border quickly. I did it as early as I could before other people would have, and so on. But some people have said, yeah, but what did you do after that? And I think there was this period where that question is a fair question. It's like, well, what did we assume it was going to get here? They were practicing containment, Emily, in the beginning, and that is the right thing to do. But once you knew that it was going to get out of there, and I think there was evidence that it was going to get out of there, then it's fair to ask the question, well, then why didn't you go to these mitigation phases? There's like social distancing and so on. We could have started setting up, taking people's temperatures and copying what was done in Taiwan or Singapore and other places. So we didn't do a lot of things that we probably could have done, and that's a lesson. I think not to be too hard on America in this scenario. If you think about what happened, and you guys might be too young to remember this, but SARS and MERS that occurred, but really SARS hit Asia many years ago. And so they were better prepared because they had lived through this in a major way before. And so they sort of learned from mistakes themselves there and said, okay, well, if this happens again, we're going to be better prepared. And they were. I think that's what you're seeing.
I remember traveling through Singapore and seeing all the workers there wearing masks. And I thought, boy, these people are paranoid.
Yeah, right.
That's what I thought at the time. I don't think that way much anymore, but
Right.
just being careful.
That's right.
Okay, so I told you that these questions might be in chronological order, but here's one because I emailed a student. I won't say the last name, but her name is Kate. And so she said, "So sorry, I don't deserve these points, but I do have two questions." I emailed her a couple days ago.
Yeah.
It's a reminder. Okay, so she says, asks, people say the virus will go away when the temperature rises this summer. Should we expect it to, is there any empirical evidence for that? Or should we expect it to resurface when the fall comes again? Like, is it similar to a flu or a cold like that?
I mean, that's what's predicted. I don't know that we know enough about this to say that. I mean, it's
Is
that's
it temperature or is it
that's what
the
that's
human behavior based on the temperature? Like if you're in Michigan and it's freezing outside, everybody's going to go into cramped buildings and malls,
yeah,
right?
yeah, yeah, right. Yeah, there's behavior. Yeah, is it the behavior or is it actually the climate? And I'll be honest, I haven't looked this up, but I think we can. We probably should be looking to what's happening with COVID in areas of the world where their climate is, like where it's warm. It's warm now, and it's when it was warm when it's like, so for instance, like Australia has the opposite season as us. So when did they have their COVID season? Is it going on and are they having the same thing? So those can be clues because this would have probably hit their, the tail end of their summer. So, and in which case maybe it would have been the same timing. So harder to tell there, but somewhere in the world, it's pretty warm, around closer to the equator, it's going to be warm even through the winter time for us. And I think we should be looking at those countries to see how they fared.
Okay, great, thanks. Now her second question, Kate's second question, and Kate, you are going to get the points. Her question was, and I think this is a good one. I mean, I've heard about respirators and those things, but it says, her question is, how are COVID-19 patients treated? What are they given as treatment?
Yeah, that's a good question. We have done mostly uh, supportive therapy. So what that means is there's not a direct treatment for COVID-19, not a first line therapy. So the hydroxychloroquine and other medications, azithromycin is another one. Those medications are really seen as being, experimental or being tested or under study. There's also antiviral medications that people are working on to create, but we don't know in which patients these individual medications will actually work, right? So we don't know what the right ingredients are yet for whom you can give a pill and that's going to be enough treatment, or who needs IV medication and treatment. So a lot of the treatment is actually supportive of fluids, respiratory positive pressure support. So like putting a breathing mask on, not a breathing tube, but just maybe a mask that helps to aerate, keep the lungs expanded, and keep them from collapsing. So it's a lot of supportive care like that that will help patients get through the more scary parts of this. Constant monitoring of their oxygen saturation is another important thing that we should do.
Okay, great. All right. Now we're rounding the corner here. We're getting close. But
And while you're talking, I was just trying to look to see like where a country like Nigeria sits on the equator, like how far north it is or south, because I wanted to compare it to America, but I can't find something that does it. But we'll have to get back to it. But you guys, that'll be a good assignment for the group. They can go look and see, because Nigeria is experiencing an outbreak now. So,
okay.
so I thought if they might be closer to the equator, that might give us a clue.
I see.
Yeah.
Okay, so our next question comes from Kendall, and in our last interview, we talked about the psychological effects on people, and so she asked me to ask you, how can people keep up their spirits during this scary time, especially students who are not sure about the school year, which is probably looks like we're gonna complete the school year this way, online, and how will that affect them for the following year?
Yeah, it's a fair question actually, and I do think that from this illness we're going to have We're going to have some anxiety. It's actually very natural. So I wouldn't say that it's a mental health problem that people are experiencing some anxiety from this. That's very natural given the amount of information that's sort of being projected, and broadcasted into our ears every day. And if you turn on the news, you're going to see that. So what I tell people to do, it's actually really good. I think just more like coping skills. Coming up with a routine is important, especially if you're someone who enjoys a routine. Then try to stick as close as you can to your general routine. Obviously, it's going to be modified if your routine includes getting up, brushing your teeth, and eating breakfast and going to school. But you can get up and do all those other things, and then you can actually do some academic work. And I think you can do school work. I think that's important. Exercising is a super important thing. Actually, does a tremendous amount to relieve stress, and create those those happy endorphins and hormones that we get from exercise. So making sure that you're doing some physical activity and keeping your muscles strong is super important. Getting your rest and not skipping meals also very important. And I think and then I think control is a really important thing. So just understanding that the things that control the things that you can, and really not worry. You can't worry too much about the things that you can't control. And so I think that those basics, um, being safe, but not trying to control every aspect of your life, because you may not be able to control every aspect, is sometimes freeing, and lets people understand that they'll have to roll with some punches here. All of that I think can help people deal with this.
So does this mean I should feel less guilty about cussing that guy out that pulled in front of me in traffic today? It's the COVID anxiety is why I said that.
I think there is some heightened anxiety that everyone's going to feel, and
Yeah.
and we will, and you can kind of feel it also happening as it settles in, that this might be a while that we're living
Yeah.
like this as we wait for a vaccine. That'll get some people down, but we will bounce back because we're very resilient. A number of my friends that I haven't talked to in a while have reached out to me. So that's been fun, reaching out to people that you haven't talked to in a while that check
Yeah.
on.
Yeah.
Also, many of my friends that I've talked to recently have said, well, let's do a happy hour. So we're going to do a remote get together with families and just hang out a little bit. Just things that we never would have said to do, but we're going to do them because of our new normal.
Right. Right. When I was a kid growing up, my dad used to sit down at the dinner table after dinner when everybody was watching TV or whatnot. And he would just be sitting there writing and writing and writing. And I mean, he'd write 2 or 3, 4 pages. And I'd ask, what are you doing? He'd say, I'm writing your grandmother. And so he would write letters. And after he passed away, we discovered letters back and forth, correspondence. I mean, he would write.
Wow.
He was such a good correspondent with people. He had such good habits, and people have since then told me about how he would write them. And boy, I tell you, I would get letters sometimes that would say, Dave, no right Duncan, because I never got back to him. So I think it's good that it is kind of making us focus in on things that are a little more important.
I think that's a great exercise. And I've been thinking through, I have more time at home, where I'm just like, okay, I'm just sitting here. So, I've reached out to friends, and I'm glad I've done it. And it's fun to keep that up. And I think it means a lot to those people too, that, they haven't heard from you in a while. So it's great. So
Yeah.
That's a good exercise. Yeah.
Okay, so here's Kendall's second question. It has to do with the physical effects of COVID-19. And that was, for the people that do get sick from COVID and they recover, maybe some of the more severe cases where they had to be on respirators and such,
Yeah.
Are there any lingering long-term effects on people? Does it scar their lung tissue or something?
Good question. I mean, luckily we have, so the answer is, first of all, like it may, it does cause scarring, and it may be long-term in some cases. The good news is, though, if you think about I don't want to talk about smoking cigarettes, because that, but I'll go ahead and do it since I started the sentence. Smoking also causes scarring, but if you stop smoking, it takes about 20 years, but your lungs can actually get you, sort of your risk level goes back to the level as if you were never a smoker. If you can quit and stay off of cigarettes and avoid them for up to 20 years. So it takes a long time, right? So that's like
and you got to stop when you're young.
you gotta stop when you're young, because you don't always have that 20 years ahead. But no, I think that's a reality here. But the other good news is on the scarring from if someone has like really severe lung injury and is on a ventilator, your lungs your lungs have a lot of redundancy in them, so we don't actually use our full lung capacity to breathe every day. Right? Like, there's a lot of reserve in there. That being said, once it goes away, it's gone in many cases. So So if you have really severe damage to the lungs, it's those are the people that you see kind of walking around with, longtime smokers who are walking around with oxygen. They've done enough damage that it's destroyed the architecture of the lung, and therefore they can't recover. So it really just depends on how severe your illness is, how long your lungs are down for, and then and how quickly you can actually get back to normal and recover and help them heal.
Okay, great. Thank you. All right, so I have a couple questions from Kira, and it has to do with the wearing of face masks, which we were just talking about. And she asks, in the early stages of the spread of COVID-19 here in the United States, we were told by many, I don't have the sources here, but this is what she's asking, that the use of face masks would not help limit the spread of COVID-19. And then lately, we've been hearing contradicting claims. Do you believe that the use of these face masks in the early stages might have helped slow the spread?
Gosh,
I know it's woulda, coulda, shoulda.
yeah, it's a fair question though, and I would say in the early going, the reason why we did not need the social distancing was because we were trying to contain and mitigate the spread. And so if we had had faster testing, I think this is an important lesson here, which is if we'd had the testing and symptom identification by taking temperatures and so on, but even just the testing alone, if we could have had enough tests and tested everyone, I think we could have, the testing has to be good tests, it has to be good testing. But if we had that, I do believe we could have done a better job. But there are so few people that would have had the illness in the beginning. That's why there was no reason for everyone to go out and buy and hoard masks, because not enough people would have even had it that there was just, the risk wasn't at that level at that time.
I want to mention something right now about testing, and I saw one of the news shows, one of the networks was talking to somebody about the percent of cases or the number of cases in the United States versus, I think it was South Korea. I don't remember the other country that they were comparing it to, but what the journalist said was, hey, we got a lot more cases in the United States. Look how many more there are here. And he was corrected by Dr. Fauci, who said, hey, we're increasing the number of tests. So you're obviously going to find more cases. Yeah. So don't jump to conclusions that it's much worse here. It's just that we're testing more people, so we're going to have more results. And I was just wondering what you thought about that.
Well, I think we probably have more people, but also, South Korea had more tests available at the beginning, and they were able to ramp their testing up sooner and faster. So I think it probably stands true that they were able to respond better. And so I do think it's a fair question the reporter was asking, but I also, think, Dr. Fauci is saying that when you have more tests, you will find more numbers. And so my guess is that he wasn't meaning, I don't know that Fauci was comparing it to South Korea, because I think he would agree that they had a better response. It's hard to argue with that. But he's making the point on it from an epidemiologic standpoint that we're testing more, so therefore we're going to find a lot more people. And especially if you test asymptomatic people, you're going to find a lot more people that otherwise you wouldn't have tested, right? They would never have shown up for a test. But I think we're trying to understand the properties of the illness and the properties of the testing, so that we can, start to get a return to normal, a return to work program designed and implemented.
Okay, so our next question comes from Luca, And his first question was, is it okay to go back to work as long as we are careful about the social distancing? What are your thoughts?
We're not there yet. Look, we're not really quite ready to end the social distancing. Clearly, if you're in an essential supply chain work job, occupation. So, for instance, if you're, food delivery, like for food delivery and things like that, I can see why we would need, or healthcare, right? Those kinds of jobs. Those folks have access to equipment to keep them safe and so on. Food delivery people have certain practices that they've been trained in also to stay safe. But if it's just, it just depends on what your job is. So, and I don't know what his role is. So there you go.
Looks like my bird died. The canary in the coal mine. I stood up and I knocked the bird over. Did you see it fall?
Carbon monoxide levels there. Your bird just fell over.
Did you see it fall over when I stood up looking for the? Oh, hopefully that maybe that wasn't recorded. Okay, so here's another. Well, okay, I told Luca that you probably wouldn't have an answer for this, but his question number 2 was, how close are we to the finish line with this thing?
Oh, yeah. That's a hard one. I think we're not going to get there by herd immunity anytime soon because 5% of the population or less may end up with this after this first wave, and that might be because we've done it. We've maybe done a good job with the social distancing. So I don't think we know. I mean, it could be 6 months to 8 months for a vaccine. Let's hope that we can produce that, and if that's the case, then I think we could get back after that. Now that sounds like a long time. But I do think there'll be a lot of pressure from the economic slowdown that people will want to do this phased approach, and it's going to be up to the governors to probably drive that.
Do you think that if they do come up with a vaccine, that our society will accept that as just like a flu shot and then go on with life as normal, or do you think we'll still have that lingering psychosis?
Yeah, no, I think a lot of Americans trust the flu vaccine. So I think that a COVID-19 vaccine will have credibility and get strong adoption. And I'll tell you why, because the vaccine should actually work better than the flu vaccine. Flu is a squirrely infection, or a squirrely virus, influenza, that can that can mutate very quickly, and so can coronaviruses. But the idea is that this particular coronavirus, the one that has made its way over from animals, is a very specific type and with a specific molecular structure. And if you can find that, and you can fool it or prepare the immune system to recognize it faster, that should actually work better than even our regular flu shot does.
Okay, so now people that have been exposed to this, there's the talk that they would not be exposed, they would not be infected again if they encounter it, or, I mean, do we actually have antibodies that build up?
We just don't know that. This is such a unique illness. It has a longer incubation period, so it has a high transmission rate. It does currently act very unlike other viruses. So I think that's one interesting sort of really interesting academic question, or intellectually fascinating question about this virus. Is this virus truly different from all others in many ways, that it's going to behave differently? So we just don't know. Yeah.
Okay. Okay. So a couple questions from Luke. So Luke has a question, and I think I can answer this first question of his with yes and yes. But here it is. Do you think that telemedicine will be used more with quarantine times?
Yes. I can tell you that.
And do you think you will see more patients?
Yeah, we are. We're seeing more patients than we projected. We're over 100%. So we're like, we're at 200% right now. So 100% over where we thought we would be at this time of year.
Wow.
Yeah.
Now, I know I asked you that last time we talked was how was the scaling doing? And you're getting more doctors that are coming on board
Yeah,
and
in the
helping
last
with
30
you.
days, we hired 300 doctors in the last 30 days. We've been approached by doctors from about 20 different specialties. The thing that people didn't realize, and this is myself included, that this was going to impact was that brick and mortar practice doctors, because they're not seeing enough patients, they are not like, I mean, they're not able to work.
Right.
So there many of them. I've been checking messages as we've been talking a little bit because I'm getting pinged by different doctors who are from allergists or rheumatologists, ophthalmologists, just different specialties where patients are delaying seeing these doctors, and so therefore these doctors are not as busy and they're not able to make a living the way they normally are used to doing that, and so they're looking for other work, and they've come to us to help find them jobs, in which we've taken as many as we can. I don't know that we can take more unless more people start using telemedicine. And so it's a little bit of we've balanced it. We've load balanced it for now, and we've caught up to the demand for now. But we'll see how that plays out.
Wow. That's quite a dynamic,
It's
like
been
a fluid learning curve here, right?
super fluid. Yeah, it's a good word for it.
Yeah. Well, make sure you get plenty of rest. Okay.
Yeah, you could probably. Yeah, yeah.
I've noticed you've been touching your face, Dr.
I
Tom.
have washing my hands religiously.
Yeah, yeah. Okay. Um, I think we've touched on these questions already. How long do you think we have to stay in quarantine?
Uh,
What is the longest it could be?
yeah.
And do you think the virus will get worse or will it mutate?
The last one we didn't really talk about the getting worse or mutate. I would say we don't know. I mean, this is I'm not worried about it getting worse. This is a good example of where like you worry about the things you can control and not about the things you can't. If it's going to mutate, it's going to do that. But I would be more focused on our ability to ramp up a virus and get it right and get the testing improved, get the
A
testing.
vaccine.
Sorry, yeah, I meant to get it. Yeah, sorry, I meant get a vaccine, and then also get the testing. Get the testing appropriate so that we can identify who's sick, and then really get an effective return to work program or return to more normal living program would be great.
Okay. The last question I have actually is generated from the original interview, and it was a parent in the community who is in the medical profession um, asked you for some clarification because and I think I did respond to them about this, but I want to give you a chance to.
Yeah.
I'll go with the student's question first. This is Nina, and her question was that you mentioned about figuring that in New York or larger cities that if someone has a cold or flu-like symptoms, then she's saying then it is most likely coronavirus. And that's kind of what the person that emailed me about this asking for clarification was, why would you treat somebody if you didn't really know that they had coronavirus? But I think what you had said was that you would just, if they're in a dense area like that, assume they've been exposed so that if they were, they would isolate themselves and protect other people. Is that what you had intended to say?
Isn't it interesting when I was there, we weren't, it's just funny. It seems like it's a long time ago because we weren't on this social distancing, right? That was like a large gathering at the school. So things have changed. But what I would say there is we didn't have adequate testing, and we still don't really actually have adequate testing supplies. So for instance, the kits and the reagent are in shorter supply. So we're under-resourced. So in those scenarios, when if you can't test everyone, that part of that is the reason why we're using universal facial coverings and why we're social distancing, is because we cannot identify all of the people carrying this illness and spreading it to other people effectively. So So what I would just, so that's why I was saying that, right? Is like, based in that scenario, if you're in New York City and you know that it's rampant throughout your community, spreading quickly, then everybody who gets a fever and colds symptoms and a dry cough and fatigue and feels achy, right? Like, I mean, basically you're starting to get sick. You kind of have to act like you have it because you don't know if you do or not until you get
Right.
tested.
Don't guess that you do have it, but behave as if you do, right?
Behave as if you do. Exactly. I think that's right. And seek medical attention virtually if you don't know, or you want to just have some reassurance of what to do, because it's a lot easier to follow you up, meeting with a follow-up visit virtually than it is in person, because again, no one's being placed at risk, but also it's not as hard to get an appointment, and we can see you within 10 minutes, so we're able to keep up with that. So I would say you're not far from medical attention in a virtual healthcare system.
A second part of that question that Nina had mentioned that I hadn't mentioned, but I think that you just kind of touched on that, which would satisfy her question, was that what about in small towns, rural areas where people are a lot more spread out? Would you approach things differently?
Yeah, no, I think it's I think that's why this is the response to this, and what's done in local communities is best served and best designed by the people who live in those communities, or the governors of those individual states who understand what their resources are, and what the social interaction and patterns are in their local areas. You may be able to, the farmers may be able to still go to work and do their job because they're not really close to anyone, and the truck that comes to pick up the supplies or pick up the crops and so on, when they're all packaged and everything, they can get that and almost do that without interacting directly with too many people. So I can see where a lot of those things are able to be done without great risk.
I know that what you were just talking about localities making decisions, this was something that we talked about prior to us starting this interview. And that was that I think it was today that President Trump announced the three-phase hopeful roll in of the economy, and that was giving state governors the choice of how they were going to roll back into things. And we had talked about how local decisions, you're much more in contact with the needs of your local citizens, and the president doesn't really know what's going on in Oshkosh or Miami. Or
Yeah, I think it'd be hard for the president, depending on what they know about an individual area, right? But we, for instance, to use you and I as an example, we are familiar with the geography of California, and where we might, and people from the Central Valley might know, right? Well, we know where our fruit, where your fruit comes from, and if you live in the Central Valley, it comes from down the street.
or the sticker tells me.
Yeah, that's right. Yeah, or the sticker tells you now.
Comes
Yeah,
from Chile.
that's
Chile.
right. Yeah. Well, I'll make this aside. Growing up in Fresno, there never were any labels on fruit. I mean, I never saw labels on fruit because it was all local for the most part. And then I went to medical school in Chicago, and I was like, there's a sticker on everything, and that's when I realized. And it was funny. And I'd read the stickers, and actually, where did the sticker say? Reedley, California, Dinuba, California, Selma, California. I mean, I was like, oh my gosh, I grew up. This fruit is coming from where I grew up. So that was a cool thing to see.
I look for California labels when I'm in Malaysia, and I find them.
And you find them. Oh no, I know they're there, and they know our brands, and they know the farms here where they like to get their produce from. But about the question on that from the governors, yeah, I think it makes a lot of sense because the governors know their state in and out. They know the resources of those states. In many cases, they grew up in those states, so they're well equipped to know the people, the travel patterns, what's safe and what isn't, and they have staff that are really have hands-on, kind of feet on the ground experience, and so that's the best place for this to be managed.
Okay, there's one last thing that Nina said, and I would echo that. It says, thank you, and there's an exclamation point past it. So that really concludes the questioning that we had for you.
Yeah, well, thanks for having me. It's been fun. I appreciate it. I wish you all the best, and congratulations to the seniors that are graduating, and I hope that they get together at some point and have a maybe it's a virtual celebration and a virtual ceremony. but the best of luck to them, and hopefully they can have a normal entry into college. And if we can get this figured out by then, that'd be great.
Yeah. Well, all right. Well, Dr. Tong, again, thank you very much. And did we talk about I think I might have paused this. Did we talk about if somebody wants to become involved utilizing Doctor on Demand?
Oh yeah, if they want to register, they can look at doctorondemand.com, and doctor is spelled out DOCTOR, ondemand.com, and or they can download us in the Google Store, the Apple iTunes, or the Apple Store. So
Okay, great. Well, that concludes our discussion on some of these questions. And again, much appreciated. I really appreciate your time. Thank you. I'm glad we finally connected, and we'll have to do this again, maybe when things are back to a little bit more normal, and I can ask you a few more pop culture questions and things that generate the likes and the hits and all those kind of things. So hit the subscribe button. And anyway, Dr. Tong, all the best to you and your family.
Thanks.
And take care.
You too. Thank you.
Thank you.
Thanks.